Good day, everyone. You're welcome to Dr. Boom's YouTube channel. I hope you have been taking good care of your health and your whole being. Please do so if you haven't been doing that. So today we have a very interesting topic that we'll be discussing, and is no other than diabetes mellitus, or what we all popularly know as diabetes. So as a way of introduction, we would start by saying that diabetes mellitus is a condition where the body either doesn't produce enough insulin or can't use it effectively. Insulin is vital for helping sugar in our body get into the body cells for energy. So when this balance is disrupted, it can lead to high blood sugar levels, causing significant health issues over time. There are three types of diabetes mellitus. We have there's type 1, type 2, and gestational diabetes. That's diabetes in pregnancy. Type 1 diabetes is often diagnosed in children and young adults when the body's immune system attacks insulin producing cells. Type 2 diabetes is more common as it is often linked to lifestyle and genetics, while gestational diabetes can occur during pregnancy, like I already said earlier. We move over to the causes and risk factors for developing diabetes. Now, first of all, have you asked yourself, why do people get diabetes in the first place? This often depends on the type of diabetes, like we have already mentioned earlier, the various types. But some common risk factors includes genetics, that's family history, if it runs in your genes, and then factors like obesity and a sedentary lifestyle. And that is why we always encourage people to be active, exercise regularly, don't live a sedentary lifestyle, take a walk. You don't always have to drive your car, sometimes just take a walk, as well as just be active. It will go a long way in preventing disease conditions like diabetes and the others, as we have already mentioned. For instance, family history can double a person's risk for type 2 diabetes, apart from the person's own lifestyle. If you are someone that likes taking a lot of sugar, you are at risk of developing diabetes. Or you like sugary drinks, you like taking a lot of carbohydrates. Like in Nigeria, a lot of people like eating eba, that's garri. They like, it's like a normal thing. Some eat it even as breakfast, some take it as lunch as well, some even go over to take it in the evening as dinner. That is a very, very wrong meal combination. That is not balanced diet at all. You must regulate your intake. Even eating rice too often, one has to be careful so that you don't put yourself at risk of diabetes. So just to mention but a few, even yam, these things are carbohydrates, so we have to be very careful with their intake in our food. We should, when you eat rice for instance and yam, or you are eating, your risk is very high. So you have to take your health seriously, exercise regularly, and if a person has already been diagnosed with it, like we'll talk about very soon, you take your medication and live your healthy life. Diabetes is no longer a death sentence as it used to be in those days. Now there are better cures, better management practices, and people are living longer with diabetes. Lifestyle diets like eating healthy balanced diet, meaning more vegetables in your meals, and then right combination of all the different classes of food. This will play a role in reducing your risk of diabetes. So eating processed food and not getting enough exercise can increase our risk, which means making healthier choices can make a significant difference. How is diabetes diagnosed? There are key tests to diagnose diabetes, and this includes the HbA1c test that measures average blood sugar over the past 3 months, and then fasting blood sugar test, as well as what we call the random blood sugar. So these regular checks are essential, especially if you have risk factors as already mentioned. So early diagnosis is very crucial as it can prevent complications and make management much easier. So if you or someone you know has diabetes, effective management is key. Like I said, people live longer these days for years with diabetes. It is no longer a life-threatening condition, but the key is proper and effective management, which includes taking your medications and lifestyle modifications. If you're the type that likes taking alcohol and smoking, you will have to stop those things, or you cut down on especially alcohol intake. You cut down on your sugar intake. You don't have to put sugar in all your meals. Sometimes you can, instead of using sugar, you go for honey. Even at that, you also put that honey or use it in moderation. You don't need to take too much of the honey. You have to take it moderately as well. In as much as you want your meals to taste sweet. We have talked about eating carbohydrates. It has to be done in moderation. In addition to vegetables, take more vegetables with your carbohydrate meals. This will help. Here are some practical lifestyle tips that can help in managing diabetes, or someone that has diabetes, as medications are not just the only way out. We go over to practical lifestyle tips. Number one is healthy eating. Like we have been hammering on that. Focus on a balanced diet that contains whole grains, lean proteins, lots of vegetables. Please avoid sugary drinks and high carbohydrate food, as all this can spike blood sugar. Two, we need to exercise regularly. Very, very important. Even if it's starting from exercising from 5 minutes or 10 minutes on most days to 30 minutes weekly, it will help. We also need to do things like brisk walking, swimming, dancing, because exercise, taking a walk, all this helps our body to use insulin more effectively. Medication adherence. For some, medication like insulin or metformin is very, very important and necessary. Those that have been diagnosed already with diabetes. So we always have to follow the healthcare providers' advice, the doctors, the nurses, on how to manage these disease conditions. Self-monitoring. Monitoring our blood sugar levels can help us understand how food, activity and medications can affect our body. So this empowers us to take control of our health. We move over to complications and prevention. If left unchecked, diabetes can lead to serious complications. For instance, eye diseases like the retinopathies, as well as even blindness, nerve damage, kidney diseases, the neuropathies, and even proceed to stroke, what we call cerebrovascular accident. So however, the good news is that these risks can be significantly lowered with early management, like we have already talked about. So for all those at risk, small preventive steps like maintaining a healthy weight, regular exercise, and making better food choices can be very transformative. Even losing just 5 to 10% of your body weight can dramatically reduce your risk of developing type 2 diabetes. So in conclusion, living with or preventing diabetes is a journey, and knowledge is our first step. By staying informed and making conscious lifestyle choices, we can all take control of our health. So this is a call to action for all of us. We need to stay informed and keep making conscious lifestyle choices so that we can take control and always be in control of our health. So please, thank you for listening. Thank you, thank you, thank you so much for listening. And please, if you found this video helpful, please give it a thumbs up and share with others. And keep subscribing to Dr. Boom's YouTube channel and inviting others to subscribe. Family, friends, colleagues, and keep spreading the good news of healthy lifestyle wholeness, and a fruitful life. We are also on TikTok, so you can visit Dr. Bones on our TikTok channel, and you will also get more health tips that will make you stay healthier. So together we can spread awareness and support healthier lifestyles. Please don't forget to subscribe to our YouTube channel, as we have already mentioned, for more health insights and practical tips. Thank you for listening to us, and please have a great day.